From the Times and the Sunday Times, this is The Story. I'm Daniel Gordon.
When we entrust our health and that of our loved ones to the care of an NHS hospital, we're expecting to be taken care of, and we're expecting to recover.
In Essex, a barrister in a sharp black suit is making his case, his notes propped up by a pile of documents.
We expect to recover because mental illness is not a terminal diagnosis, even if it carries risks to life or may have a lifelong impact.
He's not addressing a court. This is a public inquiry which is investigating over 20 years of mental health care in the county.
Fundamentally, we do not expect our loved ones to die while undergoing treatment for psychiatric illness.
The Lampard inquiry begins hearing another section of evidence today. It's investigating the deaths of over 2,000 people who received that care. Deaths which may have been preventable. I'm a freelance journalist, and while I was investigating this story, I remember being shocked by those numbers and by the fact that so few people seem to have heard about it. So over the next 2 days, I'm going to tell you about this inquiry, the first of its kind, and what it reveals about the state of our mental health services. And I'm going to start with one woman.
The point for me, and for everyone else, I think, is we want the truth.
Melanie Leahy's son, Matthew, is one of those 2,000 who died.
What I'm told has happened, what I think has happened, and what actually happened are three different things. And that's why we're in this position today, looking for the answers still.
And the fact the Lampard inquiry exists at all is largely down to Melanie. So today, I'm going to tell you the story of her and her son. I should warn you, this episode contains distressing material, including descriptions of suicide. The story today, Britain's Mental Health Reckoning. Part 1, Matthew.
Good afternoon, this is Matthew Leahy reporting for News at 10.
This scratchy recording is 13-year-old Matthew Leahy. He's pretending to be a newsreader for a school project.
This afternoon in the Caribbean island of Montserrat, disaster struck.
His report on a volcanic eruption in Montserrat is playing out of the headphones of an old Walkman in his mum, Melanie's living room.
But I didn't find it till probably six years after he died, something like that. Didn't even know I had it.
The 2,000-year-old volcano on the island has erupted. The magma has been on the move for a few weeks now.
Oh, really? Oh, wow. What was that like, listening to
Incredible.
that in his voice?
It's quite surreal, actually, because for me, this whole journey to get the inquiry, it's like I've been climbing the volcano and all of a sudden it exploded, and the ripple effect of the inquiry and what's going to happen now, that Matthew should be talking about a volcano all those years earlier.
Melanie remembers Matthew as funny.
Clever, sensitive, caring, argumentative like his mum at times, because he was very strong-willed. Don't know who he got that from. But he loved the water. I'm honest, he learnt to swim before he could walk. He loved canoeing, he loved crabbing. He was into anything like outdoors. Done his powerboating, he then got a motorbike. Shocked people, I think, at 11. He passed his 11 plus. He went to grammar school.
But by the time he hit his late teens, Matthew had started to use cannabis. He confided in his mum that he was using it to help him cope with what, at the time, were undiagnosed medical issues, including severe stomach pains.
He was getting numb fingers. He was getting sensations of things crawling all over his skin. He was getting terrible pains in his stomach. Since his past medical records has come out, he had a thyroid problem, possible celiac disease, which would account for the pains that he used to get in his stomach, and a B12 deficiency.
Matthew would go on to experience psychotic delusions.
There was times that he frightened me. There was just something not, his mental state was just not right.
In July 2011, aged 19, he was sectioned under the Mental Health Act. He was brought first to an acute unit in Clacton, and then, a few weeks later, to the Linden Centre, a squat brown brick building on the northern outskirts of the Essex town of Chelmsford. It provides 24-hour care for adult patients with acute mental health issues. Melanie describes the centre as being chaotic, with staff changes happening so frequently, patients didn't know who was meant to be looking after them.
People are coming onto the ward, they don't know who they are. In those days, you didn't have any uniform. You just in civvies, you didn't know who was a patient, who was a member of staff. No one knew, and staff didn't know, they'd go looking for Matthew. Didn't even know what they looked like.
And for Matthew, sitting in the ward was boring.
There was nothing to do. He was told he's got a gym. Yeah, there was a couple of machines there, but there was no one to run the gym, so the door was locked. He spent most of his time out in the garden smoking or with his headphones, music playing. As a mum, when I went in to visit, I wanted to complain about this and the other, but you didn't, because you didn't want to cause a problem that would cause a problem for them.
Matthew was discharged in November, 4 months after he was sectioned. And for a while, he appeared to be doing well. But in early summer the following year, Melanie noticed his mental health started to get worse again.
Between May and November, 5 times we asked for assessment for Matthew. And there was no beds. There was one excuse after the other. And finally in November 2012, crisis point again.
What happened at the crisis point?
Well, from what I understand, he was then living by his father's, and they had a bit of a row and it got out of hand. Now, Matthew was a little boy. If he got upset, once or twice I've had it happen, like there was garages at the back of mine. He went and he'd sit on top of the garages and he would just sit there, and no point me going up to go and say, come on, get down. It would be even worse. So I'd just leave him, and maybe within an hour he'd just get down and go, sorry, Mum. It was like he'd have a meltdown.
And that would be his way of dealing with it. He'd just sit on top of the garage until...
Yeah, and basically, from what I understand, he was in the marina, there's containers, and he went and set up in a container, having a meltdown.
And they're high up, are they, the containers?
A shipping container. Matthew's dad has called the early intervention psychosis team. They've now called the police. Well, whatever could have just been a situation that would have calmed right down, it ended up with 9 police officers, threats to tasers. 3 hours later, Matthew's probably absolutely petrified, and now he's in a police car. And I said, once he got in the police car, it's just like, where are you taking me to? Linden Centre. Don't take me there. But that's exactly where they took him.
What did you think when you found out that he'd been sectioned, he was going back into hospital? Did you think it might actually fix things?
I knew he needed some help. So at that time I was relieved, finally, we've been waiting all these months, let's get him some help.
It didn't work out that way though, did it?
Absolutely didn't, no.
This time, staff at the Linden Centre asked Melanie not to contact Matthew.
I was told to leave it a week, let him settle on the ward and come in.
Over the first few days, nursing staff recorded that at times Matthew was distressed and unsettled, as well as feeling suicidal, although he'd never expressed thoughts of that kind to Melanie. He was placed under what's known as Level 3 observation. That meant he should have been under constant supervision, though it was later reduced to observation once an hour. Then, 3 days after he was admitted, Matthew made a phone call to police. And I should warn you again, you might find the next few minutes in particular distressing.
Hi, 2 days ago I was sectioned in the mental hospital.
Okay.
Hello?
Hello,
Yeah?
still here?
Hi, 2 days ago I was sectioned in the mental hospital.
Police later released this tape to Melanie, and we're using it with her permission.
And since being here, I've been raped, and the doctors refused to acknowledge it. I've been raped though in the last 2 days, and I'm bleeding heavily.
Matthew tells the operator he's been raped.
Hey, can you tell me where you are?
Chelmsford Linden Centre.
Linden Centre.
Some of the details are unclear, like when he's asked, Matthew doesn't even seem to be sure about which day it took place.
When did this happen? When did this rape?
Last night or the day before. I've been in the mental hospital for 2 days and it's happened during my sleep.
Okay. Are they giving you medical attention?
No, I just told the doctor that and she says she refuses to acknowledge it.
Hospital policy says if staff are made aware of a sexual assault, then they should inform police and fill out a form recording the incident. But in this case, neither of those things was done. After Matthew's call, the police did come to the centre, but they took no further action, and no physical examination took place. Records show staff attributed Matthew's claims to paranoia. We'll never know for certain why Matthew made that allegation. But for Melanie, this all happened while she'd been asked not to contact her son. She only heard about the incident third-hand because Matthew called his father, distraught, and he in turn called her.
I called the ward instantly to talk to Matthew. They told me Matthew was in art class. And no, don't know what he's on about. And I said, well, he's just called his dad like 5 minutes earlier, sobbing down the phone that he's been drugged and raped. No, it's rubbish.
Melanie didn't know what to believe. She became increasingly desperate to see her son. A visit was scheduled for Friday, but hours before she was set to leave, she got a phone call from Matthew's doctor.
Yeah, he phoned me at 1:15 to tell me Matthew's been found hanging. It didn't look good. And that was it. I was on the floor. I couldn't even breathe.
Melanie raced to the Linden Centre, but when she got there, staff met her and they told her that Matthew had died.
There was a group of them, doctors and the operations manager, and they were asking me all these questions. I'm like, where's Matthew? I need to go to Matthew. Oh, we take you there in a bit, take you there in a bit, take you there in a bit. And they must have kept me questioning me for like 15, 20 minutes.
What kind of questions were they asking you?
Just
Do you
like,
remember?
has he called you? What's he been saying? All those sort of and I didn't know. I didn't know anything apart from he'd called his dad, the run up to it. But anything I knew, they wanted to know.
So almost like they're beginning an investigation before.
Absolutely.
Melanie was eventually taken to see him.
I'm taken into this room with the police officer and there was Matthew on the trolley. He's got the hospital gown on. He looked perfect. I bent down to kiss him and hold him. And that's when I was told he was a crime scene. You can't touch. And I bent down quickly and I kissed his forehead. And with that, an orderly was made to stand in the corner and the police officer said, if you touch him again, I'm arresting you. And that was it. I couldn't touch my son then. I couldn't pick him up and hold him. I couldn't do anything. All I got was that one kiss on his head.
More than a month later, Melanie would get her first opportunity to try and understand what went wrong in Matthew's care.
I remember it was January the 18th. It was my sister's birthday and I got a call from Matthew's dad. Oh, are you going to this meeting tonight? And I'm like, what meeting? And he had been called in to discuss the serious incident report that had been written, apparently. Well, I hadn't. I knew nothing about it.
When a patient dies unexpectedly, a serious incident investigation is normally carried out, and that's to learn lessons and stop something similar from happening again. Amongst other things, the final report that was commissioned by the NHS Trust that was responsible for Matthew's supervision revealed that his care plan, which should have been drawn up during the first days of his stay, wasn't complete. The response of staff who spotted the mistake was to rewrite it after Matthew's death. Despite this, the report concluded the care Matthew'd received had been of a good standard. And Melanie was particularly upset when she noticed the investigator had used the small bits of information she'd given them when she'd been questioned immediately after Matthew's death to justify their conclusions.
Things that I'd been questioned about the day that he died had actually been put into the report, and certain things clearly wrong.
Melanie happened to have mentioned in passing that another patient had told her he'd shared a Chinese takeaway with Matthew a couple of nights before he died.
It gets written in the report that Matthew was buying in Chinese meals, he was eating well. It turns out Matthew had absolutely nothing in his stomach. He hadn't eaten well at all. And the money that he's meant to have bought all these Chinese meals with was still in the safe. No one had given it to him.
Melanie made up her mind to take this further. She was sure there must have been other families who'd lost loved ones in the care of Essex mental health services. And she'd start by tracking them down. Matthew Leahy died in 2012 in the care of mental health services in Essex. But it was 2 months later, during a meeting with the NHS, a meeting where his mum, Melanie, was told Matthew'd received a good standard of care, that she decided action needed to be taken.
I'm leaving the meeting. I get in the car and I'm like, I can't believe that he just said this, this and this. I'm fuming.
Melanie was sure she couldn't be the only parent who'd lost a child while they were in the care of the same NHS trust. She'd actually already started to look for others with the same experience.
I'd been looking online anyway, and I read an article, Ben Morris dying in 2008, and his mum, in his memory, going to set up a boxing club.
Ben had died in the care of the Linden Centre 4 years before Matthew. His mum, Lisa Morris, had been campaigning to find out what happened to him. The article listed the street where Lisa lived, which at least gave Melanie something to go on. As she drove away, with the lines from the report ringing in her head, she slammed on the brakes.
I literally turned the car around and it's snowing. It's freezing cold. It's now like 8:30. I arrive in Malden about 9 o'clock, 9:30, something like that. And I just start knocking on the doors. Knock, knock. Hello, have you heard of Lisa Morris? Hello, have you heard? And it's freezing.
Despite her best efforts, Melanie didn't find Lisa that night. Neighbours said she'd moved. But Melanie kept digging.
I'm just looking through social media over and over. I'm trying to find her. I'm trying to find
looking
some
for
connection.
Lisa Morris, which is quite a common name as well.
4 months I was at it, looking every night. And then I go, oh. And there was a photograph of Ben with a trilby hat on. And there it is, the little circle, and it's got Ben's picture, Ben's face.
She messaged the woman who'd posted the picture on Facebook.
And said, hi, do you know Lisa Morris? She says, my mum. And Ben was her brother. And that was it, the connection was made.
Melanie and Lisa arranged to meet in a cafe.
Lisa went to pay for the coffee and she opened, I remember her opening up her purse and she'd got a photograph space in the purse. And I was straight there. Why have you got Matthew in your purse? She said, I haven't. That's Matthew. She said, no, it's Ben. And I'm, oh my God. When they were both poorly, but both lost a lot of weight, honestly, I could have said that was Matthew.
You bonded over this thing that you saw a photo in her wallet of Ben that you thought
was Matthew. Mm.
So both your sons had died in the Linden Centre in similar circumstances, 4 years apart.
Ben was that corner side of the wall, when Matthew was that side.
They compared experiences, each of them finding reassurance in the other.
We both thought we're not going nuts here, because that's the way they make you feel.
To you, psychologically, what difference did that make to have?
Oh, huge, because then you've got someone on the phone, you know, we were talking about this, that and the other. That's it, we were on it. And I know Lisa had been on it the years earlier and had to give up and had to stop because it was really affecting her, which it does. When you're hitting a brick wall that many times and no one's listening.
Is it fair to say that was kind of the start of the campaign to get justice, to find out more about
Well, it
what
was,
happened
because
to Matthew?
once we'd got the medical records together, we just started becoming detectives. We went through, we were trying to find same staff, same names. We could actually start to see there's a picture to this.
Melanie started attending inquests to find more families who'd been affected.
I ended up with evidence, I think, on 7 deaths by that time. Round about 2016, I'm badgering Essex Police to reopen Matthew's investigation.
But then police decided not to bring charges. But in 2016, Melanie and Lisa also went to the Parliamentary and Health Service Ombudsman, and they look into unresolved complaints about the NHS and other public organisations. Their report would take 3 years to complete. But then, in 2019, it found that the NHS trust running the Linden Centre at the time
did not take adequate care of Matthew's physical health,
or
take adequate action when Matthew reported being raped.
It also noted concerns about his nutrition and weight, and found
observations were not properly managed,
highlighting that nobody seemed to know why his observation level had been reduced to once an hour. The report also said the Trust's serious incident investigation into Matthew's death lacked credibility because it had been written by somebody who was involved in their words, the falsification of Matthew's care plan after his death. In Ben's case, it found there were
failings in his care and treatment, which meant there were missed opportunities to mitigate the risk of him taking his own life.
Melanie still wasn't satisfied. She didn't want any more reports or recommendations. She wanted action. So she turned to the Health and Safety Executive, which has the power to prosecute, and she focused in on one particular thing that she and Lisa had found in their research.
There was some documents in Lisa's lot which showed that the ligature points should have been removed. And honestly, that's vital evidence.
I hope you'll understand there's a need for a graphic description here. Ligature points are places in a room where a cord or a rope could be attached and used by someone to harm themselves. That could be something you see every day at home, like door hinges and furniture, which in a mental health care setting can be quite literally life-changing. The management of ligature points was an issue that had already been picked up by the Ombudsman, which found it had been a problem for years, not just at the Linden Centre, but throughout the NHS trust that ran it. A ligature point had been involved in Ben's death. In his case, it was a wardrobe, which the year before he died had been identified as low risk, but had since been fixed to the wall, which made it much stronger. At the time, recommendations had been made to take action on ligature points, but 4 years later, when Matthew died on the same ward, they still hadn't been fully implemented. In fact, the Parliamentary Ombudsman found that ligature points continued to be an issue for years, even after Matthew died.
It's inescapable that year after year there was a repeated failure to recognise the seriousness of the ongoing risks to the safety of people using North Essex Partnership's acute adult inpatient service. This is particularly true in relation to the assessment and management of risks for fixed ligature points and sharing the learning from mistakes with staff.
Melanie took box files of evidence to the Health and Safety Executive, and they'd go on to argue in court that failing to tackle the issue of ligature points was a breach of health and safety law. Eventually, a judge would fine the trust that was responsible £1.5 million for 11 deaths going back to 2004. That was 4 years before Ben's death and 8 years before Matthew's.
The court heard how each death was investigated and each time recommendations made to reduce ligature risks, but these recommendations were routinely ignored. Some fixtures like door hinges and wardrobe handles remained in place for up to 9 years after it was recommended they be removed, and in some cases the same ligature point played a role in multiple deaths.
But this was yet another process which was going to take years. And by now, I hope you're not surprised to hear that in the meantime, Melanie didn't just sit back and wait. She decided she wanted a public inquiry to investigate what had gone wrong with mental health services right across Essex, believing that was the only way she'd ever get the full story of what happened to Matthew. So she started a petition on the government website.
And we need the nation to know that we're not going to go away. We need to call for a statutory public inquiry.
If she could somehow get 100,000 signatures, the issue would be debated in Parliament.
So I started it, and I just sat at home and I messaged out. I'm at 4.5 months. I got 47,000 signatures.
By this point, it's got to late 2019. And while Melanie had been working on her campaign, a lot had been happening elsewhere in British politics.
I've just been to see Her Majesty the Queen earlier on, and she agreed to dissolve Parliament for an election. Come with us, get Brexit done, and take this country forward.
And I'd written to the petitions committee and said, hold on, Parliament's closing, what happened? She said, oh, your petition will close. And I'm like, wow, I'm going to get arrested until January. That's good. Oh, I'm tired. And she said, oh no, it'll go to zero. What? Yeah, it'll go to zero. You have to start again because new government. Oh my God.
After the election was called, there were just a few days before Parliament would dissolve. That's a hectic wash-up period where urgent business can be debated. After that, all of Melanie's hard work, collecting all those signatures, would get wiped out and she'd have to start her petition again from scratch.
I got till Tuesday. If you can imagine, I'm swearing, there's all sorts going through my head. So it's now Saturday, and I contacted the girl that done Cure the NHS. She'd had success. And she said, Mel, get some banners. She said, go to Downing Street, and explain where I need to stand. And I've never done anything like that, you know. Really? Emily Pankhurst, here we go. Okay, I'm going to do it. So I'm due at a christening on Sunday. Lisa, if you hear this, I had to tell you a fib. I said that someone had fallen down the stairs so I could stay in and have time to design these banners. I emailed what few press contacts I had at that time. And at 8 o'clock, I'm in the printers. I get home at 10, 11, got my little bag, my trolley dolly and some clean clothes. And Colin's like, where are you going? So I'm going to London.
Take it, have a read. It's about the death of my son. I'm just asking for signatures on a petition.
Together with a small group of supporters, she handed out leaflets. And then they headed to a pub to get the message out on social media.
2 iPads, 2 phones, and started. Staff were coming over and, what are you doing? And we're telling them they had entertainment on in the pub. So I'm on the mic, packed pub, telling everyone. They all started sharing and signing. Anyone that will help, we need to, you know, we've got a deadline, we've got to do this. By 9 o'clock on the Tuesday, we hit 100,000. Don't know how we did it.
It was almost a year later that the petition was finally heard in Parliament.
So, Mr Stringer, I beg to move that this House considers e-petition number 255823 relating to deaths in mental health care.
I ask the Minister, on behalf of Melanie Leahy, to set up a public inquiry. Only a public inquiry will have the transparency and broad participation needed to rebuild trust in the services.
The government agreed. An inquiry was set up. But a year and a half later, there were still problems. The inquiry had called for evidence from NHS staff who'd been involved in caring for mental health patients in Essex between 2000 and 2020. But it didn't have any statutory powers, so it had no way to compel anyone to give evidence. Out of 14,000 staff who were invited to share their experiences, only 11 came forward. The chair of the inquiry wrote to ministers asking for statutory powers. And the families Melanie'd spent years bringing together decided they weren't going to engage unless that request was granted. So the government relented. 12 years after Matthew died, his mother's tireless campaigning had finally paid off, with new leadership and the power to compel evidence from NHS staff. The Lampard inquiry began in the autumn of 2024.
I'm Baroness Lampard, and with this statement, I'm opening the hearings of the independent statutory inquiry.
Tomorrow, I'll tell you what the inquiry's heard, and I'll hear from a whistleblower about whether anything's changed since Matthew's death.
They failed me as a staff member, and they failed the patients miserably.
I contacted Essex Partnership University NHS Foundation Trust about Matthew Leahy's case. The CEO, Paul Scott, said, "As the inquiry progresses, there will be many accounts of people who were much loved and missed over the past 24 years, and I want to say how sorry I am for their loss. All of us across healthcare have a responsibility to work together to improve care and treatment for all and to build on the improvements that have already been made over the last 24 years. The producers today were me, Daniel Gordon, and Edward Drummond. The executive producer was Kate Lamble, and sound design and theme composition were by Mao Lassetto. If you've been affected by any of the issues raised in this episode, we've put details of organisations that offer support in the show notes. If you have any thoughts on what you've heard, please get in touch at thestory@thetimes.com. See you tomorrow for part 2.